Well, good morning, everyone, and welcome again to another live this morning. Hope you're having a great day thus far. And a lot of good questions came in, so we'll look at that this morning, and hopefully we can answer pretty well all the questions. And good to have you on with us, Nativity, this morning. Okay, so don't be shy, say hello. And Charlotte, how are you this morning? Okay, hope you're having a great day. And John, good morning. Okay, and Maureen from Nova Scotia. Rosa, good to have you on with us. Dawn, good morning to you. Terry, it's Friday. It sure is. Evangeline from Cape Breton, and Rita and Jerry from Hatley, Quebec. La Belle Province. Jerry from Nouveau-Brunswick, and our friend Dr. Troy from Newfoundland. Morris from North Bay, and Anne from Saskatchewan. Good to have you on. Diane, bonjour Diane. Our friends, Diane and Jean, good to have you guys on. Jeanette, bonjour from Hearst. Pauline, Keith, I missed somebody back there. Another one from the Belle Province. Susan, how are you? Angela, good to have you on with us. And another Susan from Thunder Bay. Lorraine and Annette, hold on. I wonder if somebody I missed there back there. It bothers me. Pauline, there you go. I missed you. Good morning, Pauline. And Francine from Nakina. And Diane and Robert too, because both Diane and Robert. Okay, good to have you on with us this morning, Donna. Here we go. And Zohor from St. Louis, Missouri. Good to have you on. And good to have you on, Lorraine and Pam too. Okay, so I know I miss people. I try not to do that, but we love you. You guys know that. Yalan, bonjour. And Esther from Miami. Good to have you on with us. Okay, so here's some of the questions that were asked. I'll try and go through all of them. Some of them I'm going to answer individually. Just get back to them because I won't have time to do all of them. Somebody was asking about chia seeds and what do I think about them? Do they elevate estrogen? No. They don't specifically elevate estrogen, but they don't diminish estrogen like flax seeds do. And so I always talk about flax seeds because they have lignans, L-G-N-A-N-S, lignans, and lignans decrease estrogen. That's why I like them. And one thing about flaxseed, you do not have to grind them up, because that was sort of something that was on the internet. Oh, they're no good unless you grind them up. I don't know where that came from. Your stomach will grind them up. You don't have to grind them up. If you want to grind them up, I don't care. But I'm just telling you, you don't need to do that. Your stomach is a grinder, okay? It is a furnace and a grinder. It'll grind up those seeds. And I got no problem with chia seeds, okay? I don't. But they're not flax seeds. So if you're going to choose a seed, and especially for lowering estrogen, that's a big problem in our society today. 2 growth hormones: insulin, food, crappy carbs, sugars, and estrogen. The environment. Every chemical in the world looks like estrogen to your body. And ladies, you got to lower your estrogen. Oh, doc, my estrogen's going down. I'm menopausal. Nah. Yeah, it's going down, but it's always in relationship to progesterone. And we're dominant in estrogen. And, people ask me about HRT therapy, okay? Hormone replacement therapy. Be very careful because they're giving you horse's urine. It's horse's urine. a pregnant mare, their urine. And my old friend Dr. Fishman used to say, if you start eating hay, then you can use HRT. Otherwise, don't touch it. But make sure you diminish, diminish that estrogen. So that's why I like flax seeds. Okay? And because of lignans. Now, be careful with seeds too, because for those who have diverticulosis or diverticulitis, or for some people that bothers them, and they can get caught in those little pouches. So always be careful with that. Okay, and so they just on that, someone was asking about oxalates. And one of the questions about it was autism and oxalates. Well, I really don't want to comment on that. If you can send me the specific, it was Deborah. Deborah, if you send me a specific article that you read or whatever you saw, I never, like oxalates I talked about the other day. So if you want to go back and listen to leaky gut, leaky kidneys, I talked about oxalates. Oxalates come from the plant kingdom, including seeds. And for people that get kidney stones, and the problem with oxalates, okay, if you live on that, the plants, is that they bind up your minerals. You're not going to absorb even calcium and whatever you need for your bones. A lot of times oxalates just bind them up. That's why you can't live on it. Does Dr. Martin eat vegetables? Yeah. But I don't live on them. I don't live on them. Maybe next week I'll talk about osteoporosis, because there was a study that came out on osteoporosis, and they said like it's an epidemic today. Why is that? Well, one of them, obviously, if women get osteoporosis more than men, it's almost 90 to 10%. Why? Well, obviously one is hormones. But it's more than that. A lot of it is nutrition. And I'll touch on that, okay? So oxalates. Go back and listen to, we spend a lot of time, but they come from the plant kingdom. And oxalates are a byproduct of the plant kingdom that your body can't use. And unfortunately, for a fair amount of people, they have trouble getting rid of them in the kidneys, because that's where the majority of the oxalates are sent out of your body, at the kidney level. They can stress the kidney. Okay? All good questions. Somebody was asking about creatine. To use that as a supplement or in a powder. I got no problem with that, like creatine. But do you know that bone broth has creatine? Yeah, has that amino acid. Because bone broth has all the amino acids. That's why my favorite protein powder is bone broth. Collagen protein. It's got everything in it. All the amino acids, all the minerals. It's why it's my favorite. Lots of L-glutamine, which regenerates the gut and repairs the little wee lining of your gut. So yeah, if you want to take extra creatine, there's some studies on building muscle and good for you. I got no problem with that. I don't have any problems with that. Tanning beds, what do I think of them? Well, be careful. Look, if you have extremely low vitamin D levels and you can't get to Florida, then a couple of sessions of the tanning beds, I'm not against, to elevate your vitamin D. Better that you supplement, in my opinion. But some people they're extremely low, and I'm not against it. But you got to be very careful with tanning beds, okay? Like in terms of their skin cancer rate. It's not like the sun. I'd rather you do it naturally, but I'm not against it, okay? But be under supervision when you're doing it, and don't do a lot of it. Don't do it just for tanning, okay? Don't do that. Louise, Omega Oil, she was asking about a specific brand. Well, Louise, I'm not going to comment on any specific brand. I really won't. Here's what you look for. You want a good omega-3? Well, first of all, eat it. You get it in fish and you get it in steak. A lot of omega-3 in there. And there's omega-3 in the plants, but they're short chains. So don't get omega-6 oil, or don't get omega-9 oil or whatever. You don't need that. Don't, even a hemp seed oil and all that. Like, you can get it, but that's not the best in terms of omega-3, because what you're looking for are long chain. The longer the chain, the more bioavailable that oil is. And every day I take a high DHA oil. That's what you look for. The higher the DHA, the better it is. So just read DHA. And EPA. EPA is important too, but DHA, because that's the one that fixes the brain. So you can get a cheap omega-3 if you want. It's not going to hurt you. But if you want therapeutic, if you want to therapeutically help your brain, therapeutically get your inflammation down, then you need high DHA oil. That's the one that puts the fire out in your body. Sounds kind of funny, you're putting oil in to put the fire out, but you really do put the fire out of inflammation with high DHA. Okay? You're not going to get me to change my mind. I've had too many years of experience with it. The higher the DHA, the better it is for brain, for your heart. I talked to you, I think, a little while back in one of the podcasts. I talked to you about how omega-3 works, and especially the DHA. It reduces the stickiness of your platelets. It reduces the stickiness of your blood. It reduces the inflammation. And that's a big, big factor. It lubricates all your joints. It lubricates the brain. Remember, your brain is made up of DHA. So those are good questions, okay? I appreciate them very much. Let's talk about some conditions that people ask me about. One was H. pylori. Now, this is look, almost everybody that is listening today has H. pylori. What is it? It's a bacteria in your stomach. So what, I tell people. H. pylori doesn't bother 95% of the people. And if they don't test for it, you never know you have it. Leave it alone. Now, if you're getting symptoms, H. pylori out of control can cause an ulcer. If you're getting bad stomach problems, and they say H. pylori, well, you can kill it with a broad spectrum probiotic. Did you know that? And oil of oregano. That's why I love digestive enzymes. We put oil of oregano in the digestive enzyme, or you can take oil of oregano. That kills H. pylori, and so does a broad spectrum probiotic. What is broad spectrum? Many, many different, everything's in Latin in medicine. You ever notice that? Why? To keep the masses from asking questions. Right? They don't want people asking questions. So H. pylori, what's that mean to people? I mean, what is it? It's a bacteria. Okay, so like I said, I'm not big on taking an antibiotic for that. I know they recommend that, but I'd rather you do it naturally. Now, I'm not saying if it's driving you insane and I don't want you to get an ulcer and whatever. And if you do have to take an antibiotic, then make sure you double up your dose of probiotics for a couple of weeks. You got to replace all that bacteria, because the thing is with antibiotic, there's so much friendly fire. They will kill all your good guys too. That's the problem. That's why I like probiotics and oil of oregano. Do you know oil of oregano don't kill your good guys? It's a nature's antibiotic. I love it. I love it. There's no oil like oil of oregano, in my opinion. Essential oil like that. It's the best. Other ones are good. It's the best. Just my clinical experience. Colon cancer, the good question. Now, we talked about this. Why is it so prevalent today? And what are the factors in colon cancer? Well, the big thing in colon cancer is candida. It's yeast. It's fungus. And the problem with candida is in medicine, they never even look for it. I think somebody was asking me online if, what can I show to a doctor that I have candida in the brain or parasites in the brain? I said, well, good luck. I remember Dr. Oz or whatever had a show on parasites. Now, this is about 10 years ago. And he got so much blowback from the medical profession. They don't like parasite. A parasite can't get into your brain. Yes, they can. A lot of people have parasites because they don't put gloves. You know, when they tell you to put a mask on for COVID, don't be so scared of COVID. Be scared of parasites if you got a cat in your house. Yes. They lick their butts. And they're cat littered. Put gloves on. Make sure. There's a lot of people, I've showed them parasites. One lady came in and said, Doc, if I have a parasite, I don't want to know about it. I said, well, you better turn your head. I'm looking at one right now. See the little thing crawling across the screen. Now look, a lot of parasites don't even hurt you. Your body knows what to do with them, but some of them do. And candida. Okay, so that's one of the big things that starts colon cancer. Having a crappy carbohydrate diet. Sugar, it feeds yeast. It destroys. We talked about high fructose corn syrup. Why do we see so much colon cancer today? High fructose corn syrup. You know me, it always takes like I said, it's like Monopoly. That sugar does not pass go, meaning it goes past your intestine to go directly into the liver, except that on the way to the liver, there's something I learned. If I ever stop learning, stop listening to me. I have to keep learning. Because what did they find out about high fructose corn syrup? It's well worth going to listen to that podcast again. On high fructose corn syrup, something that we learned that it destroys the line, it causes leaky gut, plus it feeds yeast. So if you're asking what causes, why do we see so much colon cancer in young people today? Food. Another one, antibiotics. They can save your life, but they're a double-edged sword. They destroy all your bacteria, your microbiome in the gut. It creates leaky gut. Leaky gut, leaky brain. Leaky gut, leaky gut. Can affect your gut. Not everybody has digestive symptoms necessarily, but if you've taken an antibiotic, you better replace the bacteria on colon, because there's so much colon cancer today. And it isn't the lack of fiber. No, too much fiber. I get the commercials, the cereals full of sugar, but oh, are they ever good because they got lots of fiber? Oh, jeepers. Who cares? Get rid of the sugar. Okay. High bilirubin. Well, if you got high, look, there's a syndrome called Gilbert syndrome. And it can be genetic. But I used to test bilirubin. I was very interested in bilirubin in the urine, because it always told me the person started fatty liver. It's one of the things that we see. Bilirubin. It's a start of fatty liver. It's a liver issue. And, some say it's gallbladder. Yeah, but gallbladder's attached to the liver. So bilirubin, liver, clean your liver out. Do the reset. Another question on the reset was about the brain. Does it regenerate the brain? Yep, it helps. It helps. Because you're replacing fat. The fat you're eating, the saturated fat, the omega-3 fatty acids from eating eggs, meat, and cheese help the brain to regenerate. Plus, you got no sugars. So what does that do? That helps with insulin resistance in the blood-brain barrier. I've talked about that. You regenerate the blood-brain barrier. The reset helps that big time, especially with the addition of probiotics, because probiotics help to not only for your gut, but for your brain. Yes, yes, yes. The reset is so good for the brain. And look, try not to wait till you get dementia or Alzheimer's. When people come to me and I already got, they bring their loved one or whatever and they got dementia already. I wish I would have seen this person, because the diet has a huge, look, what do they call Alzheimer's? Type 3 diabetes. It's sugar. That's why diabetics are so much more susceptible to dementia and Alzheimer's. And even if you're not a diabetic, if you're a pre-diabetic, if you're a carboholic, you're in doo-doo. You're in trouble. You got to fix that, because it's going to affect your brain. Oh, doc, I get away with it. Maybe right now you are. But you have no idea what's starting in that brain. It doesn't happen overnight. Question was asked about gestational diabetes. There you go. During pregnancy. It now makes you much more susceptible to diabetes down the road. And gestational diabetes is one of the factors in autism. We've talked about that. And autism, where I told you, it's leaky gut. I've never seen an exception to it. There's certain things mommy has gone through on average. There's always exceptions to what happens to mommy and what happens to baby. But the evidence is pretty clear. And I look at the origin of it. The perfect storm in a baby for autism. Leaky gut. 100%. Mommy has leaky gut. Goes through the placenta. The microbiome of the baby is changed. So the idea, even in pregnancy, it's so important to have a good diet before, during, and after. Someone was asking online yesterday about, can I stay on the reset? Absolutely. I've had people on there 4 or 5 years. If you're a diabetic, you should be doing the reset almost 24/7, 365 a year. Because you have an allergy to carbs. How many people have an allergy to carbs? Oh, doc, I got acid reflux. You have an allergy to carbs. You and carbs don't get along. When you figure that out, it'll change your life. Yes. And in this day and age, most people have that allergy. What are they saying? 88%. I read that every day. 88% of North Americans have one form or another of metabolic syndrome. And metabolic syndrome is insulin resistance. It's the scourge of our society today. Blood clots. Some people are more susceptible than others. The medication you would take are all to blood thinners, aspirin even, rat poison. There's a rat poison that they give you to stop your platelets from clotting. And look, I'm not telling you not to do it. You don't want to have a stroke. And you don't want that blood clot if you had problems with that. But I find, for people that are susceptible to them or have had blood clots, in your legs or whatever, then wear the compression socks. And, one of the best exercises I find is the rebounder. Not only to elevate your nitric oxide, which opens up your blood vessels, but it does really, really help. I like that. If you can do it, the rebounder. So good for you, to diminish the risk. I love Navitol. But Navitol elevates your nitric oxide. So that's why we love that product. It's one of the things that it does. Someone was asking about high ferritin, high iron. Again, it's like an epidemic almost today. Why is that? The liver. It's the liver. It's fatty liver. You have high ferritin, fatty liver. Oh, but my doc didn't tell me that. Yeah, I know. And they want to take blood out of your body or whatever, and I'm not saying don't even do that. But why is it happening? It's liver. Your liver's gummed up. The Costco parking lot. The suitcase. It's gummed up. Why does it get gummed up? Sugar. Crappy carbs. That's how your liver gets gummed up. That's how you get fatty liver. Someone was asking about, how do you get a virus? If I'm not around people. Well, that's a problem. It's a problem because, listen, you guys, I got my both hands up. Now, remember, I always have to tell on here, because you're watching it live, but for later, it's going to be a podcast. So just understand why I do this. I have my both hands up, okay? And I want to explain this. One, you have a virus. On the other side, You have your immune system. Okay? And like I said, doctors, not all of them, but most of them, virus is everything. A bacteria is everything. Fix the virus, fix the virus, fix the virus. But I'm much bigger on your immune system because I'm in a room right now. I have a microscope. You see that microscope behind me? Okay? You see that? If you're live, you can see it. See that microscope? Well, if I took a swab anywhere in here, there's not billions, there's probably trillions of viruses in here and bacteria. What planet do you think you're going to go on and live to get away from viruses or bacteria? You're not. Your body itself has trillions, not billions, trillions of bacteria. Some good, some bad. You're around viruses all the time. Oh, I don't go see people. I don't recommend that. You know, when kids, you don't want to isolate, especially children. You know, the classroom is a good place for kids. You know why? Because they're exposed to all different, you know, if a kid gets a bug, like, Mommy, I understand it. Grandma, we don't like to see kids sick, but sick is actually good. Oh, Dr. Martin, I never get a cold. Well, good for you. You know, but we're around stuff all the time. You can't get away from it. Wash your hands. Yeah, I agree. Okay? Don't touch your face. Good luck with that. Social distance. You see, for me, there's one school, and then there's another school. The one school, the virus, the bacteria, the infection is everything. And the other school is, let's get our immune systems in good shape. Well, you know what school I'm in. I'm aiming directly at you. My soapbox is for you. I'm preaching to the choir. And to those you can influence yourself. Get your immune system in good shape. We talked about vitamin D, the studies. How important it is to have good vitamin D levels. Vitamin A, which you find in vitamin S steak. You get zinc in steak. You get vitamin C in coffee. Well, somebody did ask about ascorbic acid. How much ascorbic acid to give to a children? Well, they're not missing the ascorbic acid. Where the child misses is vitamin D. I mean, if you want to give a kid vitamin C, I got no problem with it. But the real vitamin C is coffee. It's got a lot more polyphenols. I'm telling you. So, no, I mean, you can give a kid, look, one thing about vitamin C, if you're going to give it to a child, the only side effect of vitamin C is when you take too much, you'll get diarrhea. The body will tell you. I like vitamin C as a therapy with IV treatment, massive doses for cancer. I like that. I got no problem with that. But just taking vitamin C, I'd rather you drink it. And have some of God's candies for the kids. Fruit. They got a lot of vitamin C in there. You got a lot of vitamin C in vegetables too. Yeah. So really, really, really good questions this morning. Okay. So I hope I hit all of them pretty well. I did. There's a few, like I said, I'll just get back to them individually just because for a lack of time. And sometimes there's a very specific or very rare condition. And we just, on this program, we're not necessarily going to cover it. Okay. So you guys have a great weekend. Hope you enjoy. Fall is, I know it's not officially here, but in Northern Ontario, fall is here. Okay. And you guys have a great weekend, and we'll talk to you soon.